Hello, everyone. I'm Dr. Beatriz Olson. I am an integrative endocrinologist, the author of the #1 best-selling book, Mind Body Secrets, and I am trained in feminine-powered transformational leadership. This message is for my women colleagues, women in healthcare. I want to talk to you directly about the problem that we're facing in medicine right now. We have a broken system in which we have been disconnected from our service as physicians. It's a business that has taken over and disconnected us from ourselves and from patients. Often we have to see many patients over a day, so we don't have time to listen to them and connect to them. If we prescribe medications, we are unable to give them what we want to give them because insurance companies don't allow our patients to receive the medicines that they truly need. Our work doesn't value us in the sense that they expect that we work all day and then go home and continue to fill out charts and do work that should not be required because this is red tape. Instead, we should be home with our families, enjoying ourselves and having life-work balance. In addition, we as women have been raised in a system that is male-oriented. So we have to evolve ourselves to fit into the system. Often we have not been seen, we're undervalued, underpaid, not considered for races within systems. And often there's biases against us because we actually do take care of our families. Many of us are working as doctors and don't have a lot of backup at home. So we have to take care of children and give birth to children. All of those things take time, and we're seen differently because of this capacity. At this time, given everything that is happening, what I'm seeing is that we're so unhappy. Many of us are leaving medicine. Many of us are not willing to tell our children that they should go into medicine. But I know we all went into medicine because we cared and because we were inspired to make a difference. And I felt the same way many years ago and felt that I should leave medicine and go into art school instead. And somehow I discovered mind-body medicine with Deepak Chopra in the late 1990s. And through this experience, it changed my way of thinking entirely about medicine. We had been trained in a disease-centric system. That's our conventional medicine training. Whereas all of a sudden, I learned that in mind-body medicine, things were different. First, there is this interplay between the mind, the body, and the spirit, and the influences from these places actually creates outcomes of health for patients. Another aspect of this holistic approach to medicine is that there is the knowingness that our body has innate capacity for healing if we give it the right things. And currently, our foods are processed, our lifestyles are not supportive to the wellness that we deserve. And because of that, we're getting diseases. Well, in mind-body medicine, there's a sense that there's a spectrum between wellness at one end and disease and the other. And mind-body medicine empowers you to deal with prevention and reversal of the whole-centered patient approach as opposed to a disease-centric approach. Once I embraced this knowledge, it inspired me so much that I could bring this into my training. And I have since combined my allopathic training, and I continue to be board certified and love my training. Yet I bring a new experience to my patients. And through this process, I embodied this myself. And it changed my health, my choices, and my satisfaction in my work. In addition, patients are delighted to be given multiple choices, not just those from the conventional system, but other choices that are available that are safe for them to do, which empower them to create better lifestyles for themselves. because of this inspiration that I had, I transformed the way that I have practiced. And I'm inspired to share this with you because I think I want to offer you the possibility that you can be re-inspired again in practicing medicine, and that you can have agency again over your life and over deciding how you're going to choose the things you do and create more life-work balance in your life. To do this, I have created a very special course. It's a foundational course in mind-body medicine, which I'm calling EmpowerHer. It'll be a 3-month program where we meet weekly. In this program, I am going to give you all of the tools I have that you can bring directly to your practice to share with your patients and to offer them more than you're doing right now. Patients will be so satisfied and you will feel well that you're doing something more than pushing buttons in a computer to complete criteria. This program will teach you many aspects of mind-body medicine, including through cases that I will offer you how I deal with digestive diseases, hormonal problems, weight regulation, and many other common problems that we deal with in medicine. In addition, a big focus is about stress reduction and embracing and connecting to ourselves. And I believe that we as physicians need to connect with ourselves and be well within so that we can offer others our skills with more abundance. So in this course, I will give you the methodology to bring directly to your practice, to bring it right away. And in addition, we will work closely as women physicians to empower ourselves and explore some of the mindsets that we have as physicians and as women that interfere with our capacity to see higher possibilities for ourselves and to make choices that are more life-giving. This is a very small program. It's for 6 to 12 women. And after you finish, you'll be able to say that you know how to practice mind-body medicine and that you can bring these to people right away. You can bring it to your life. And if you choose not to stay in medicine, you can bring this to any career you want to. This will be by applications. There is a landing page that you can click on to apply for this program. And once you and I talk and decide whether you're right for it and you're ready, then you can join us to create a beautiful collaborative community of women, because I believe that if we heal the doctor, we can change medicine individually. And if many of us do that, we're the beginning of a big change. It is up to us individually and as a group. The system depends on people like us to help medicine and to help humans be better. I hope you join me. And I thank you so much for listening to this. And if you know other women in healthcare that may not be receiving this message, I hope that you can share it with them. And I look forward to beginning our course October the 9th and carrying it through to December. And I hope to see some of you on the other side. Thanks for listening and have a wonderful day.